And we will get started with Dr. Rob Rivers, who is the program lead from the short-term research experience for underrepresented persons, Step Up, from the National Institute of Diabetes and Digestive and Kidney Diseases. Dr. Rivers, the floor is.
Thank you so much, Vincent. This is a great pleasure, and felicitaciones a todos para estar aquí un sábado para ver tu futuro. So number one, the fact that you're here on a Saturday all day shows your commitment and dedication to consider careers in medicine. However, for this session, I want us to look and think beyond just how you can enhance your resume through research, but how you can actually consider what could be a future career calling through research. So I'm not going to spend the entire time speaking about my specific program. Rather, I wanted to give you a more high-level view of opportunity, because beyond the programs that our institute runs and other institutions runs, I think it's important for you to consider and try research for more than the resume benefit, but for also the opportunity that it could change your own future career. Everyone here knows that if you do summer research or year-round research, your resume is improved. However, by doing that research, you also have the opportunity to see what differences you can make in a lab or in behavioral science to improve care for everyone. The director of the National Institutes of Diabetes, Digestive, and Kidney Diseases, Dr. Griffin Rogers, often says that a physician may see 100 to 200 patients a year, maybe more. However, a researcher who develops a cure or develops steps to a cure is actually impacting the lives of millions. So with that said, 7 things to take home with you, 7 take-home messages. Inherently, everyone on this call, we're all scientists. We're all born with innate curiosity as kids. We want to know what's going on. And the fact that most of you want to be physicians, the fact that you still want to know what's happening means you're the right people and the right person to be part of the physician scientist workforce. Secondly, research, and more specifically medical research, extends your impact on society and our communities. The vast majority of individuals who decide to go into medicine do it because they want to see an improved opportunity, improved health for the people they know and the people they live next to. And by doing research, you're expanding those opportunities for everyone around you. Number 3, there's a plethora of scientific research experiences available. I'm going to put in the chat our program at NIDDK, which provides $5,500 over the summer to do research related to diabetes, digestive, and kidney diseases. But literally, if you just go to Google and search summer research internships, you'll find a ton of options. So I encourage you to literally just go to Google, type it in, and see what's available. Number 4, you should not pay to do research. It's a job. So if there's any opportunities that say, oh, you need to pay to be part of this, that's not an opportunity I would encourage you to take, because the vast majority of opportunities pay you to be to actually work in the research lab. Additionally, I know sometimes after undergrad, there's a need to take certain courses or to improve MCAT scores and increase likelihood of entering medical schools. I would encourage you to consider post-bac programs that are paying you to do research, and the National Institutes of Health have several of those. And if you check out training.nih.gov, there's a zillion resources on how to prepare for interviews, how to prepare your resume and CV. Okay, we're almost done. I said 7, so we're now at number 5. Try your best on everything, and then you never have a reason to regret. So that goes not only when it comes to applying for medical school, but in everything you do. So as you're considering doing research to build your resume, take that step back and really explore the opportunity to do that work. Whether it's community-based participatory research, or it's using RNA-seq to better understand infectious diseases from COVID to Zika. Really get your teeth in there. Try to figure out what's going on. And see if this is something you're interested in doing. Because if you can combine medicine with research, your impact is triple, double, extremely multiplied. Number 6, and I've mentioned it before, but I want to make sure I'm clear on this. Literally Google summer research opportunities and you'll find a ton of them. And then lastly, if you have any further questions, I'm going to put my email address in the chat. Feel free to email me or send me a message via Twitter. I'm sorry I don't have as much time to stick around because I have a family commitment starting directly at 2 o'clock. But if you follow up with email or a message on Twitter, happy to respond, happy to answer, and best of luck. Felicitaciones. You guys are going to do amazing things. Let us know how we can help you get there. Thank you.
There we go. All right. Thank you so much, Dr. Rivers. We'll go ahead and bring up our next panelist, Mr. Harold Baker, Director of the Summer Health Professions Education Program, or SHPEP, and Kim Bellamy is the Senior Specialist of Diversity and Policy and Programs at the Association of American Medical Colleges. The floor is yours.
Okay, good afternoon, everyone. Happy Saturday. Hope that you're having a wonderful time. It's been a great event for us. Kim and I were really happy to be here and excited to tell you about SHPEP. And SHPEP is a free, did I say free? Free summer program for current college freshmen and sophomores who are interested in the health professions. And we have 7 health professions that are offered by SHPEP. And when you come to our floor, we'll be on floor 4. Come check us out. We'll have some slides and we'll be able to tell you a lot more about SHPEP. But I want to get you interested and get you excited about swinging by our table and learning more about SHPEP. And some of you may already know about the program. It's been around since 1989, so a long time. And it is funded by the Robert Wood Johnson Foundation. And it is free because of that funding. And we're at 12 different program sites across the country. I can name a few off the top of my head. University of Washington in Seattle, Columbia University in New York, University of Texas Health Science Center in Houston, the University of Alabama, Birmingham, and Howard University. So those are just a few of the 12 program sites that we have to offer. And as far as the health professions pathways that we provide, we also train along with dentists and aspiring physicians. We also train people who want to enter pharmacy, physician assistant, nursing, optometry. So we have 8 different health professions pathways that you can prepare for. And what's the goal of SHPEP? The main goal is to ensure that students are prepared to submit a successful application to health profession schools. So make sure that you are ready to go as far as your application to whatever health profession pathway that you choose. So I see that our slides are up now. And so that's the list of the different health professions tracks that we provide. So I would ask that we go to the next slide, please. And while that is taking place, I'll tell you a little bit more about SHPEP. And so during that 6-week period, that's a wonderful picture of our health professions students in SHPEP. But during that 6-week period, not only are you doing academics that will help prepare you for the rigorous academics in your health profession training program, but also you'll have an opportunity to do a lot of mentoring. You'll work with the faculty who are at the health profession schools, whether it's medical school faculty, dental school faculty, etc. And so you'll have that opportunity to work with them. And you'll also be able to do, I'm going to blow the screen up a little bit so I can see it as well. You'll also be able to do a lot of things that will prepare you for entry into your health professions pathway. But these are the actual requirements for SHPEP. As I said, you must be a current freshman or sophomore, have a a minimum of a 2.5 GPA. We are strongly encouraging students from underrepresented backgrounds or students who actually want to serve students who are from underrepresented backgrounds in the health professions to participate in SHPEP. And the application is currently open now, so make sure that you come by our table so we can tell you more about it and you can apply. And if you have already applied, began the application process, make sure that you talk to us so we can get you to hit submit and turn in all your documents. What are the activities that you'll do? This is a great list of activities. It's about the exposure. It's about that career development. And it's also about, in my opinion, that mentoring and guidance that you'll receive not only from the health professionals that will work with you, but also the current health profession students that are at those schools. So you can bend the ear of a medical school student who's in their second year, and they're there to make sure that you can follow in their footsteps. So those are the things that you'll do when you participate in SHPEP. Next slide, please. So again, we need all of your official transcripts. And you'll note that we're doing SHPEP virtual this summer. Didn't get an opportunity to mention that, as you know, of course, you probably would figure since we're all virtual now. But it's a great opportunity to continue to make those connections even in the virtual space. And you'll also need one letter of rec, and that letter of recommendation can come from college professors, or if you're or your health professions pre-health advisor, or if you're a freshman, it can come from a high school science teacher, high school guidance counselor, etc. Next slide, please. All right, so as I said, the application is currently open. It closes at 11:59 Eastern time. So you West Coast folk, whoa, I totally messed that up. West Coast folks, say that 3 times fast. You West Coast folks need to turn it in by 9 p.m. on February 5th. And all materials must be postmarked or stamped by that day. And then we'll do our big reveal of where students have been admitted on March 15th. So the final slide should be next. Oh, this talks about our personal statement guidelines. And again, anytime you do a personal statement, and you're all college students, so you've done some, make sure that you talk about where SHPEP will help you get to. So you want to get to a certain point. You want to get to medical school. You want to get to dental school, etc. So talk about those things and how your background and preparation and interest has prepared you for that. So make sure that you tell us about yourself in that personal statement. Next slide. And those are some nice application tips. The main tip is to apply early. That's 100%. We have lots of applications that have been open but haven't been submitted, and we know that students usually submit at the final moment, but don't do that. If you can submit that application early, we'll get it reviewed and you'll be on your way. So make sure you do that. And then another thing we want to remind you is don't forward us your transcripts. We need them to be as official as possible. So we do have an email that you can have your registrar's office email your transcripts to us. And next slide. All right. And so I will go next slide and turn it over to my colleague, Miss Kim Bellamy, and she will take it from here.
All right, good afternoon, everyone. I know that we are up against time because the recruitment fair is about to start in a few moments, but if you guys would just bear with me for the next 7 minutes or so, I'm just gonna share some tips related to preparing your resume and personal statement. I know that with SHPP, we ask students to share a little bit about their why and why they're interested and pursuing the health professions, or making a difference in terms of increasing diversity within the health professions. And the previous program that was highlighted by Dr. Rivers also requires a personal statement as well. So I just wanted to share a few quick tips there. I'm going to see if I can share my screen, and we will see how that goes. Oh, and there it is. All right, so personal statement is all about telling your story. Like I said, you're going to be telling more about your why. And I know that you all may also be thinking about, okay, how does this differ from a resume? So I'm going to go over those quick tips. Next slide. So with a resume is 1 to 2 pages. I would like to say focus on your skills, a heavy emphasis on the different skills that you may have picked up from your academic experiences or professional experiences. If you've had a part-time job, if you've done research, as Dr. Rivers referenced, if you've been involved in another summer enrichment program opportunity, that's where you detail some of those different skills that you've picked up there. And it really gives that reviewer or employer a preview of what's ahead if they bring you into their program or bring you into their place of employment. With your resume, you're covering some 5 key areas. The what. So what did you do? When did you do that? So you want to include the dates that you had that experience. How did you do it? So were there particular tools that you use? Were there some type of platform, whether it be a computer software, or did you have to do some type of research to complete that? The who element, did you do that work independently, or did you collaborate with a group of different individuals? You want to highlight those things within the bullets of your resume. And then what impact did you make? You want to make sure that you're covering what results were achieved, or what did you learn from those experiences. Now, how does that differ from your personal statement? Personal statement is 1 to 2 pages, or whatever word limit that may have been established there. Focus on the purpose. Like what is your why? Why do you want to have this experience? Why do you want to gain this additional experience? It's an opportunity to provide more details. Like I said, the resume is more of a preview. You can go into much more detail about your unique story with your personal statement. And then typically, depending on who's asking for it, it's in response to specific questions. Next slide. So where do you start with creating your personal statement? One, you want to do research on the organization that you are submitting this to make sure that you have a good gist of what's their key goal, what's their key mission, and does it resonate with you in terms of some of the things that you want to learn and some of the things that you value. Then you're going to outline what has been your previous experiences and what are your future goals. So making sure that you're taking a look back and say, okay, these are things that I've already achieved, and this is how joining this organization or participating in this experience will help me grow. And then the last thing you want to do is check for alignment between the two. Does their mission, the mission of the organization, match your future goals? And then making sure that you're able to communicate that within that personal statement. Next slide. So tips for telling your story. One, you want to avoid cliches. So both Dr. Rivers and Mr. Baker talked about their programs, and they're both health related programs, but you want to avoid the typical cliches of, I want to complete this because I want to help people. That is one that I hear pretty often. And yes, I know that going into a health profession will allow you to help others, but you have to go a little bit deeper than that and say, what specific experiences you've had, a family member has had, what things have you encountered that makes you really compelled to do this work. The next thing, you want to be authentic. So you want to highlight what your key strengths are, but also be very transparent about what are some areas of improvement for you as well. I don't like the term weaknesses, but what are the areas that you can improve on, and what can you gain or learn from completing that particular experience? You want to follow the instructions set by the organization. So if they've asked you to address 2 specific questions, which we have 2 specific questions for SHPEP, you want to make sure that you address those questions clearly. Again, showcasing your why. So what is the deeper meaning behind you gaining this experience, and how will it have an overall impact moving forward? And then lastly, review and review again. So you want to review your personal statement, but also have a friend, a teacher, a faculty member, your health professions advisor, someone else needs to review that as well, just to get additional feedback there. Next slide. And that is all. So if you guys have any additional questions on how to prepare that personal statement or what's the difference between resume, I will be at table 4 with the SHPP group, and we'll be happy to answer any questions you have.
Great, awesome. Thank you so much, Kim, Harold, and Dr. Rivers for your time. I know we're a little bit over time, and I know there's some Q&A. But what we're going to do is we're going to go ahead and break for the recruitment fair as well as the mock interviews personal statement. To the students who do have a 2 o'clock and 2:15, you should have your schedule. And then also we have 6 floors full of recruiters. So feel free to go ahead and network. And we will see you all at 4 o'clock for the next panel. Thank you very much.